So friends, before I hand over the session to our beloved faculty, Dr. Uma Rao, let us just do 3 minutes of meditation and then I'll hand over the session. So friends, let us sit straight. Let your vertebrae be straight, but relax. Whole body should be relaxed. Legs crossed, hands locked, close your eyes. And you have to watch your thoughts. Flow of thought is mind. In other words, we will be watching the mind. When you witness the flow of thought, you will be witnessing the mind. You will be seeing the mind. When we witness the mind, when we see the mind, the character of mind is when it is observed, it will disappear. Frequency of thought will come down from beta to alpha to theta and delta levels. In other words, mind becomes calm, cool, meditative. When mind is cool and calm, automatically our parasympathetic nervous system gets activated. On the other hand, when mind is full of thoughts, frequency of thoughts above 14 thoughts per minute, it is called alpha level. In that level, we'll usually have tension, stress, anger, anxiety, etc. It is called, in that state of mind, the sympathetic nervous system gets activated. When the sympathetic nervous system is activated, heart will palpitate. It will send a lot of blood to heart and all the muscles, and you will be fully aware. In other words, you may have sweating. Body will prepare you to fight or flight situation. Imagine that you are coming from a second show film, nobody is there in the road, some people attacks you. What happens? That state of mind is called sympathetic nervous system is activated. In that state of mind, you can't digest, you can't sleep. Sweating will be there. Sometimes even you can urinate also. No control. Whereas when we meditate, when you observe your thought, mind becomes silent, our parasympathetic nervous system gets activated. When parasympathetic nervous system is activated, all the digestive enzymes and hormones will be secreted to the optimum level. The happy hormone, dopamine, will be secreted to the greatest level so that you become very happy hormone. You can digest well, you can sleep well, you can perceive things very well. You can handle any number of assignments without getting disturbed. So just practice it every day. You have to 5 to 10 minutes, once or twice a day. Sit down quietly, just observe your thought. Watch your thought. By practicing this meditation, you will gain a grip over your mind instead of mind having a grip over you. When mind is seen, observed, it becomes silent. It cannot take you haywire. When mind is silent, mind will not use energy. In other words, you are rejuvenated mentally and physically. Watch your thought. Don't allow any thoughts to crop up. Now gently rub your palms. Make a cup out of it. Close it on your eyes. Slowly open your eyes. Friends, yesterday we had a enthralling session on speech therapy. It will be continued today. I'm sure all of you will enjoy the session and learn a lot, and you can straight away practice with whatever you learn. Because I'm sure we have the best of faculty to teach you through Uma Rao, Dr. Uma Rao. So I don't want to take much of your time. I'll hand over this session and welcome Dr. Uma K. Rao on behalf of every one of you. Welcome, madam. You can
Thank you,
take
sir.
time.
And incidentally, I'm not a medical doctor. So I'm a doctor of engineering. And whatever medical knowledge I have is thanks to Ravindra sir and Samsthan. I have learned from them. Okay. So yesterday, thank you all. The response was very good. And firstly, all of you understand that being healthy is different from not having any health issues. They both are not the same. Okay. So when you say I am healthy, doesn't mean that you don't have pain anywhere or you don't have any problems. It basically means that you're able to deal with your body and its issues. So while treatment is a cure to some issue in your body, being healthy to a large extent is a mental state. So all of you should aim to be healthy, to think health all the time. And one of the major, I would say, impediments for cure, which I have found even for simple things, is especially as we age, the inability to accept that your body will have problems. So the first thing anybody comes to me is for something, they'll say, I'm not able to walk, I have a pain in the knee. The first thing they say is, I don't know why it happened to me. I was fine till last month. I climbed, I had a trek, and now suddenly I'm not able to do. And then somebody is detected with, some illness is detected. Immediately they say, I don't know why it happened to me. What did I do? It will happen. Your body is meant to decay. Otherwise, how will it leave this world and go? So don't crib about your illness. Cribbing about your illness is a major impediment to recovery of any kind. Okay. So always think healthy. I say the first thing when you get up in the morning is start your day with gratitude, because for everything you have, there'll be at least 10,000 people who don't have the things which we have. Right? So a few of you are sitting and listening to my lecture. Something you will get out of it. So many do not have that opportunity. So like that, everything in your day you can realize which so many others don't have. So that's also a part of being healthy. And don't identify yourself with your disease. You're not your disease. Your disease is for your body, right? So don't ever introduce yourself as I am diabetic, I have high BP, I have a kidney issue, I have a heart issue, I am a cardiac patient. No, you're not a cardiac patient. Your heart has some problems, but you are not that problem itself. So I always say, you are not your disease. You're not your disease. And lastly, don't keep talking to everybody about your health issues. Talk to your doctor and maybe your family members, that too if they have to know about it. I hear so many conversations. The first thing I ask when I ask people, especially the elder ones, how are you? It'll just start with, "Ayo, my sugar went up high last month, and then it went low, and then I can't walk." I read a beautiful statement last week. It says, don't discuss your problems with people. 90% of the people are not interested in your problems. I repeat, 90% of the people are not interested in your problems, and 10% of the people are happy that you have the problem. So, a very important thing about maintaining good health is the right attitude. You might do a lot of treatments. Why does some treatment work very well for some people, but it doesn't work for others? So keep your mental health also, and always think positive. Okay, fine. So with this, we will see how to apply seed therapy. How to apply the seeds, basically. So yesterday we saw some very simple ways of mapping the entire body on our two palms. I had sent the chart. I hope you have looked at the chart. So we'll have a quick recap, which is enough. So this, the thumb, right? The top portion of the thumb is your face, and this is your throat region, right? And these four fingers are your two legs and two hands. So if this is the left hand, this is the left hand, left leg, and right hand. Then on the right hand, it's right hand, right leg, and left hand. I told you how to identify. Then this part of it is your entire trunk. And this line, in palmistry, this line is called as the lifeline. Okay, this arch. So this side is above your diaphragm. And I told you, you may find some other correspondence also, no issue. So your lungs, your heart, and this chest level, all those are mapped here. And then you have your stomach, and this is my left hand, so your liver to the right. And this is a very important point. So this is the last point in your gut, the anal point. Okay. And then you have the large intestine, and your small intestine is somewhere in the middle of your finger. So, and at the back, I have here the cervical region, that is from here. Okay. So the cervical region is the first part of the vertebrae, and above that you have the medulla, and the medulla connects to the brain stem. So any pressure in the cervical can lead to pain anywhere in your body, because that is the entry point for the signals from the brain. Okay. And here you have the back. So this is the lowest part of your back. That is your coccyx bone, the bone where you sit, on which the pressure falls when you sit. And then it goes like this. And on either side, I told you to see, here is your kidney. That's all. So simple. Okay. So now let's see how you apply the seeds. I hope you have got seeds with you. I had told you yesterday, if you need a good learning experience, it would be good if you can do it. So I think quite a few of you are students of acupressure. So you know this is the tape we use. Okay. This is a paper tape, or it's also called as a surgical tape. Make sure you buy a good brand like 3M, Mycopore, Leucopore, because otherwise the gum can cause allergy when you stick. Okay, so make sure you buy a good product. And you get generally in two sizes. One is this 1/2 inch, and you get a 1 inch tape. Okay, so now I'll show you the way you can look at this. So here I have a string of methi. Okay, it's not in an exact line. I didn't take time to do it. It need not be in an exact line also, but you need it all over, right? So there are some gadgets. They may be available online also, or you can make one yourself. If you want a straight line, what do? Take a cardboard box with some, slits in between, and then you can put the methi seeds in the slit, and then stick the tape, and you will get the methis in a straight line. Or you can get one made with wood. Just take a wooden piece, saw it, make a groove. You can get a straight line for a methi. Anyway, you can do it. So that is how you stick the methi seeds. And then you would stick a bean like this. This is a rajma seed. Okay. I'll tell you where to use, what to use. And then the other commonly used seed is this black chana. You can use mutter also. Mutter, I normally don't use because it's circular. So if it falls on the ground and we don't see it, there are more chances you slip because it's round. So I prefer the black chana. You can use mutter also. Okay. And if you're traveling and you don't have any seeds with you, you can even use some small pebble you find, no problem. So now let's see a few issues for which you can treat. Common ones. Now, don't ask me, somebody is having a kidney failure, they are under dialysis. Can you tell me what seeds to use? We are not going to discuss those things. We are going to discuss normal, simple, day-to-day issues, which you can easily take charge of. The first one is problems with your eyes. What are the common problems we have with our eyes? Burning. Nowadays, burning is very common because of a lot of pollution. Okay. And then you can get itching, tears, dryness. And most of the protocols I'm going to tell you is what I have used and it has worked. For me, dryness is a very common problem because I travel a lot. And where are your eyes? Where will your eyes be? Thumb. So this is the face portion, right? This is the face portion. Now I'll just mark in different colors so that you can make out. So let's mark like how the kids, when we are kids, how we draw a cartoon. So you see the ridge here. So that, see, I have marked in red, right? That is your nose. Just like how your nose is protruding, you will find a small ridge there. That's your nose. And then, where are your eyes? Away from the bridge. So these are your eyes. The two black dots I have marked. And away from your eyes are your ears. So it will come at the back. And your mouth is here. So you see, a nice cartoon you have. As I said, you don't have to take a tape, measure exact dimensions, because you're going to use a seed where the area of the seed is quite big. It's not very small, not like a needle. So approximately, if you can locate it, it is good on the thumb. Okay. Now, for any problem with your eyes, what would you do? Let us say dry eyes, burning, or watering, irritation. Just take 2 methi strip, 2 methi seeds like this. 2 simple methi seeds. This distance will depend on the width of your thumb and just put it like this. See what I did? So here is 1 methi seed, here is another methi seed. It's sitting exactly, I have adjusted it to where I marked it. So it is sitting exactly in the positions of the eye. Now, whenever you apply seed, remember one thing. The seeds should not get wet because we are dealing with energy. And once water falls on the seed has life in it. So once water falls, then the seed takes energy from the water and it will not help you to balance your body energy. Whereas if you use magnets, there's no problem when the magnets get wet because magnetic property does not change when water falls on it. Therefore, whenever you apply seeds, apply it at a time convenient for you where water does not fall on the seed. That's the first thing you have to remember. Second, don't reuse the seeds. Once you apply it, remove it, throw it. And if you want to apply again, use fresh seeds. The third one is how long you should keep it. So best is if you can apply in the night and remove it in the morning. Otherwise, apply it in the daytime for a couple of hours, 2 hours, 3 hours. And then later on, if it gets wet, remove it and then put it again. The next question, how many days? Till you get relief. And after you get relief, continue for some more time. Because unlike a medicine, supposing, you take a medicine, you have a prescribed antibiotics, you have to take for 3 days, 5 days. Otherwise, it can cause some harm. Here, there is no side effect. Okay, so you can continue. After your symptoms disappear, just continue for a few more days so that whatever is the problem is entirely cured. Right. So these 2 simple methi seeds will help you for any issues. I have used it repeatedly on myself, on my colleagues. Because as I told you, I'm in teaching profession, and when we do online classes, or even when you sit in front of the laptop for a long time, you have burning eyes and so on, you can just do this. And never forget acupressure. The simplest thing is applying pressure. Just do this. You'll get immediate relief. Now, whenever you have symptoms, there are two things. One is relief, another is cure. Relief is what you look for immediately, short term. Cure is longer term. The root of the problem goes out of your body. Okay. So for that, you have to continue. For that, you have to continue for some time. So this is the first thing. Your eyes. Next, nose. Very simple. One single seed. One single seed. Just put it at the nose point. Or you can put 2 seeds. So that if you're not sure exactly, it will cover the entire ridge. You close it. And whenever you apply seeds, for a few minutes, just few times, just press it. And then leave it. Okay, few times. You can just press and leave it. Press it and leave it. This you can use for all problems with your nose. Itching nose, blocked nose. And sometimes, you have a burning sensation when you go out. There's a lot of vehicle pollution, etc. For all that, you can use this on your thumb. Clear? Next. You see where I have drawn the mouth? I have drawn the mouth here. And I myself was surprised. When I was working, one of my colleagues came. She ate something. Some of us suddenly develop ulcers the moment we eat something. One very common food item which causes this are nuts, especially walnuts. A lot of people, the walnut, after it becomes slightly stale, the moment you eat it, immediately you start getting, your tongue at the sides, it cracks, you get some small blisters. It happens. Or for some people, some vegetables, like, if they eat radish, or radish is one thing which I have found causes allergy in some people, and other is bangan, brinjal. Brinjal also, the moment you eat brinjal. And the roots like sweet potato, yam. Yam is that big root, the big one. That causes irritation and immediate ulcers in many people. Okay. And what I have found is just applying black color like this gives instant relief. And in fact, we had gone on a trip to Kerala, and one of the persons developed it. I just put it, and within half an hour, all that burning, blisters, everything subsided. He was so excited. He said, I'm going to open a shop and then just put color. I can earn a lot of money. Or you can put some seeds here. Okay. Now remember one thing. Whenever generally you have issues with your tongue and mouth, like ulcers, a lot of people get ulcers on the inner part of the mouth. So what is that ulcer? It breaks, the skin breaks, it looks whitish or reddish, deep red. Anything with the mouth is an indication that your digestive system is not okay. Okay, the digestive process is not okay. So all the fluids in our body, they maintain some level called as the pH level. pH level means it's a number. Any level is a number. So if this number is greater than 7, that means that fluid is alkaline. And if it is less than 7, it is acidic. If it is less than 7, it is acidic. So in our stomach, the enzymes are highly acidic. So the pH will be low. Okay. Most often, many of them have a neutral value. That is somewhere around 6.8 to 7.1. So when your saliva becomes very acidic, you tend to have a lot of blisters in your mouth. So in such cases, if it is not just an allergy, like I said, when you ate something, but it is a long-term issue, that means it continues. You have a lot of ulcers. Then along with the mouth point, you also have to apply seeds to your stomach and small intestine point. As I told you yesterday, the stomach majorly, the enzymes, they're very acidic. They break the food. They break the food and make it into a liquid form, more or less a liquid form, and push it to the small intestine. So the digestion process, actually, the absorption of the nutrients, water, etc., majorly takes place in the small intestine. Majorly takes place in the small intestine. So if you have issues continuously with your mouth, tongue, a bitter taste, or sometimes a bad taste in your mouth, etc., what you do is you apply like this seed here and also on your stomach. Where is the stomach? Here, we saw yesterday. You have the heart, lungs, chest here, and here is the stomach. One approximate way for you to locate it is you take your ring finger, bend it, and see where it touches the palm and this area. Okay. And your small intestine is here. If you remember yesterday, the large intestine is like this. And inside that is the small intestine. So it more or less comes in the center of your palm. Center of your palm. Okay. So you apply pressure here. And whenever you want to apply pressure, what you do is you can actually push your thumb at the back and give full pressure with your fingers. This will give you a lot more pressure than using just like this. Okay, can you see it? It's easier. You can give a pressure like this, squeezing. It should be hard because I told you the entire concept of acupressure is stimulating the cells. Stimulating the cells. So if you make it very soft, the stimulation is not sufficient. But don't do it so many times that you get bruised. You do it for about 10, 15 times with a rhythm, leave it, and again you can repeat. Again you can repeat. Clear? So we saw nose, eyes, mouth. Now let's come to the ear. Ear is here at the corners. So ear, what problems you can have with your ear? Ear pain is the most common issue with the ear, or blocked ears. So sometimes you have a problem of tinnitus. Tinnitus means a ringing sound in the ear, some sound in the ear, right? So there are some points, other points for tinnitus, but this also can help. So you just put 2 methi seeds on either side. One on this side. See, one on this side and one on this side. Right. Now, remember, any disturbance in the ear normally causes vertigo. People feel giddy. So if you're giddy, the first thing a doctor would do is they would test your ear. So there is an imbalance in the fluid in the ear, mid-ear especially, or there's a mid-ear infection, then the person feels giddy. So the moment somebody feels giddy, this I have also tried it. I've tried it on an elderly person. Immediately hold the thumb tightly here and press with all your strength. This upper portion. So this covers your head region and also your ear. It also covers your ear. Just press it tightly. Ask them to sit down and do it. And that giddiness will come down. Or you may feel giddy when I used it when I felt giddy when I was going on a Chardham Yatra and it was very hot and immediately it worked. Just sit down, close your eyes and do this. The giddiness will fade. Done? Simple things. So all these are all day-to-day problems. You can easily deal with all of them. Now, let us look at some other problems. Yeah. Now let us look at pains. I have found seeds very effective in pains, in pain management. Now, why do we get pains? One is when we are young, it is because maybe some injury. You hurt yourself somewhere. But as we grow older, stiffness, lack of lubrication, especially the knee, lack of lubrication. And another common problem is the heel. Because of some calcium deposit, you get pain in the heel. And then slowly, maybe at the age of 50s, 60s, you start getting sciatical pain from your lower back. The pain starts and it continues down to your knee, either on the front side or the back side of the knee, and it may go up to your ankle. The next common pain is shoulder pain. Everybody who uses laptops, I have found in my students, in my family, everybody has neck pain because continuously your neck is bowed down. So, and you have a lot of pain in your shoulders. Agreed? These are the most common pains. Now for pains, I'll show you how to apply seed. But before that, as I told you yesterday, try to exercise your joints. Very, very important. Do gentle exercises. You need not go to a gym or anything. No. Yoga. Best is yoga. So if you don't have time, much time, 1 hour yoga, no. 15 minutes is all you need. Make sure you activate all your joints. I'll give you one very interesting thing I observed very recently. I had been to the US and I was staying with one of my students. And his wife was keeping her right hand like this, in this position, and always working with her left hand. Then I asked her, are you a left-hander? She said, no, ma'am, I'm a right-hander. Then why are you working with your left hand? She said, I can't move my right hand. I said, is there pain? She said, no pain. Then I said, let me see. And then I moved her hand. She was able to move, no problem, up, down, rotate, everything, no pain. Absolutely no pain anywhere. I told her to lift up, whether you have a shoulder pain, no pain. Then I said, when there is no pain, why are you not moving your hand? Because normally we don't move only when we feel the pain. She said, I don't know. I don't know why I don't move my hand. Then she was paying a physiotherapist heavily. That day the physiotherapist came. I saw what he did. He did exactly what I did. He lifted her hand up, then pushed it like this, like this. This is what I did. Anyway, there's no pain. I said that physiotherapist is not going to help you because you don't have pain. So in what way will the physiotherapist help? Don't waste your money. Actually, you know what had happened? Very interesting. She did have a shoulder injury. Okay. And because of the shoulder injury, she had pain for some time, maybe a couple of months ago. And when she had the pain, she was holding her hand like this. Okay. And then she took some physiotherapy, everything, some medicines, and that pain had gone. But her hand was not moving. So I was very, fascinated, and I did a lot of work on that. And ultimately, you know what, I was just reading what is the kind of research people do. And ultimately, it is just that when you don't use a particular part of your body for a long time, the brain forgets to send signals to that part. It doesn't send signal. And this is not taught. I'm not talking of the mind. I am talking of the physical brain and the connection network of the brain. The brain is very smart. Very intelligent. So it says, okay, this hand is not moving, so I don't have to send any more signals to this hand. And it optimizes. Our body is very optimal. Nature doesn't waste anything. Nature is very, very optimal, very stingy. Only what is required. That's what happened to her. So since she had not used her hand for a long time, anybody who has undergone a fracture, you will see, supposing your leg has been in a cast for 6 weeks, after 6 weeks, they'll remove the cast. Your leg will be fine. There won't be pain, but you can't move immediately. It will take a long time for you to again move and be back to normal. right? So this is why I tell everybody, you have to use your joints. Otherwise, apart from becoming stiff because of lack of lubrication, there is a full chance that you will feel pain, or you will have an inability to move it because your brain doesn't want to send signals. Clear? So for pain management, it's just not enough if you take whatever medicine you want to take Ayurvedic, allopathic, painkiller, do acupressure, but along with it, make sure that you address the pain physically also. Okay, fine. So now let us take a few common problems and how we address it. The first is very common, as I told you, is frozen shoulder. Frozen shoulder. So what happens in a frozen shoulder? You can't lift your arm. It's extremely painful, and you'll find that people scream. They, when they have to lift the arm, they say, "Oh, ma!" They shout because it's so painful. Very, very common, frozen shoulder, right? So now let's say my left shoulder is frozen. Left shoulder is frozen. So yesterday we saw that, the hands and legs are mapped on the fingers, on these 4 fingers. So in my left hand, this is my left hand. So in left hand, this corresponds to the left hand. This is the left leg. This is the right leg. And this, I told you, you have to hold like this and move from left to right. This is how you see it. So left hand, first, left leg, right hand. So this is my left hand. Okay. And in the right hand, the little finger is the left hand. The mapping of right hand in the little finger is the little finger for the left hand. So first thing what you can do is, anybody who has a frozen shoulder, you ask that person to hold this tight like this. This is the shoulder joint. This is shoulder, this is elbow, and this is the wrist. This is the wrist. So just like how you have on your body, this is the front part of the shoulder, and this is the back part. So let's not bother too much about the exact location here or 10 centimeters. We know this is the shoulder joint. So the first thing you can do is ask the person to hold this finger tightly like this and twist, rotate. Rotate a couple of times. Leave it, repeat. And you will just, I have tried it with a patient, and when you rotate this, they say, something is happening here, something is happening here. Even to this day, it doesn't, I don't, it doesn't cease to fascinate me how a pressure somewhere can affect something else. So rotate. Nicely you rotate. Okay. And then what do? Which is the shoulder joint? This is the shoulder joint. So take a methi strip like this completely. I told you can put it in a line. I told you some ways. I don't have that groove here. Otherwise, I have made a groove on a wooden block. So a nice line you will get. Now put it around the shoulder joint like this, like a ring, completely. So you need not bother whether it is front shoulder, back shoulder, here. Just put it like this. You don't have to be stingy with seeds. Seeds are cheap and they have no side effect. So you can just put it around. And as I said, keep pressing it. Press it for some time, like this. And then leave it. Only thing you have to ensure with seed is see that it doesn't get wet. If it gets wet, throw it. Do whatever work you have to do and then reapply. Clear? Very, very easy. Shoulder. And normally, elbow joint, we don't get pain unless there is an injury. Most common is tennis elbow. People get what is called as tennis elbow, where some repeated movement, writing, if you do a lot of writing, or maybe if you do some hard typing, you may get it. But if you do a soft typing like in a laptop, generally you will get wrist pain rather than elbow pain. Simple. Instead of putting it in this joint, this is the elbow joint, put the methi strip around the elbow joint. Put the methi strip around the elbow joint. And there are some very, very, as I said, simple exercises for frozen shoulder. Like you just have to hold your hands up against a wall and bring it down slowly. Or you just sit like this and push back your shoulders completely like this. Your whole back is pushed like that. There are a few simple exercises. You can find any number of exercises on YouTube. Just go and do it. Definitely, your frozen shoulder will unfreeze itself and you'll have a lot of relief. You'll have a lot of relief. Okay. The next common problem, what did we see? Knee. Knee problem. Now, generally, whenever you have a knee problem, one could be injury. Another could be lack of lubrication. Especially with age, the lubrication goes. So that is where exercises do help you to lubricate. Gentle exercises are there for the knee. It's a must. Anybody above 50, I request all of you do it. Otherwise, knee problem becomes a major issue. You'll not even be able to walk comfortably. So whenever there is an injury or inflammation, you can first apply a cold pack. Cold pack. Cold pack means you get those gels, no? You can keep it in the refrigerator. The gel will freeze and then you can just put it on the knee. And then for lubrication, you can apply a warm pack, a hot water bottle. If there's a lack of lubrication, a hot water bottle will help you. This is from Ayurveda. That's what, they do it in Ayurvedic medicine. Now, which is your knee joint? This is my knee joint, right? The middle one. This is my left leg. On my left hand, this is the left leg. On my right hand, the right hand ring finger is the left leg. Okay. So that you practice just 2-3 times. If you see, you will get familiar. So this joint is the hip joint and this joint is the knee joint. Very simple. Same trick. Apply a methi ring. I do this for myself. I have an issue with my left leg. Okay. I have stiffness. So if I don't do yoga for 2-3 days, I'm not at all comfortable. And this is what I apply. Immediately next morning, absolutely, I won't have pain. Now, very often, your knee pain comes as a result of improper posture because you have a pain in the hip. So there will be some pain in the hip. And to reduce that pain, unconsciously, your brain will adjust your walking posture in such a way that the pain is minimum, which will start to an improper weight allocation on your knee and you will get a knee pain. So what I suggest and what I normally do and I have found effective is, along with the knee joint, also put a strip on the hip joint. As I told you, you don't have to be stingy, no problem at all. So put a methi strip around the hip joint and around the knee joint and around the knee joint. Easy, very, very easy. Yes. Now let's come to some more problems. If you have, as I told you, problem with urination, maybe burning sensation when you pass urine, number one, or I have used this treatment very interestingly in very different kinds of problems. I'll tell you what, this is the last portion, right? What you do is, and at the back also. So I just put a methi strip like this, a small strip with a few seeds, about 8 to 10 seeds. So a few in the front and few in the back. See how I put it? About 4 seeds are here and 4 seeds are here. Right? 4 or 5 seeds. I'll tell you for what all cases, how effective it has been. First, for urinary problem, mainly burning sensation during urination or a severe pain during urination. I have used this. This I have used for myself because I got it when I traveled extensively. Second, menstrual cramps. I have given it to so many school children, quite a few school children and, adult women also who have cramps and severe pain. Just these seeds in 2 cycles, the pain has eased out totally. So what I tell them is you start around 3 to 4 days before your cycle starts and continue another 2-3 days after your cycle ends. So about a week on the whole. And all of them have, said it's very, very effective. If they're close to me, I give magnets. If they're not close, I say you put seed. Seeds people have reported to be equally effective. That's the second thing I have used the same. The third is, I told you yesterday, somebody I knew had a big abscess at the bottom where she sits because of long sitting hours. And I told her to use this, and she said her abscess got cleared. And fourth, very interesting, a very common problem with teenage boys is what is called as ingrown hair. Ingrown hair means hair always comes out of a body, right? Anywhere, wherever. And wherever you see it comes out. So sometimes it goes in. It happens especially when the hair is thick. So very common for men, sometimes what happens when they shave, it'll be sort of thick, the hair, it'll go inside and cause infection. And the same thing can happen to your hair in between your butt. So there was one person who had an ingrown hair, a boy of around 18 years, and causing a lot of pus because it was infected. And he's been taking treatment for 1.5 years. And he said nothing works. Like it just goes and comes continuously. So I used 2-3 more magnets to drain the pus. But then also he said it's not giving me so much relief. Suddenly I thought, why not just try this out? I said, you put this seed like this here, along with the 2-3 magnets I gave. I said, put this. The moment he started putting this, after 3 days, he said, Auntie, the pain has subsided so much. And now he says it's more or less under control. So this is a very, very important thing here, this point. So what I would say is any issue you have with your lower region, either your genitals or urinary tract or any infection there, you can safely apply here, and I'm sure you will definitely get relief. I have found excellent relief in many, many cases. Clear? Next, throat. Throat problems. So where is the throat? Here is the throat. This is this upper region. Here you have, and then that will be this region and here. Sometimes what happens, we will not be able to isolate the pain, especially children, they'll say it's paining here. They don't know exactly where it is paining. Then you say, is it paining at the side? Do you have tonsils, everything? Don't break your head. Just put two strips around both the thumb joints. One here and one around this. And you can put a pepper seed here. Somehow I have found pepper seed to be very effective for throat. One pepper seed is all that I put here at the middle, because that is this point. Here, the center of this is this point. I just put one pepper seed, and many, many people have said it gives them instant relief. And because pepper has heat in it, it's a lot of heat. I think as a home remedy, whenever we have a throat irritation, we put pepper in water, heat it and drink it. So you can put a pepper here. If you don't have, you can also put a methi seed here. Right? Next, tonsils. Here, the glands here will swell at the side. Glands here, this glands will swell. So where does this map in our finger? Can you tell? This is the front portion. Yeah. So it is at the side. So simple, you see the logic. You already got it. So this is the front, this is the back. It's at the side, so it is here. So what will you do here? Take a methi strip, put it at the side. That's all. Put one this side and one this side. If you have pain here or a swelling in the gland here. My daughter lives in Sydney and she called me that day and she showed some big swelling here. Don't know what it is. She said, I don't know what it is. Suddenly when I got up in the morning, there's a big swelling here. I just said, okay, put it here. And these two joints also, I said, you put seed. That's all. She said in the night, she said, Amma, everything is gone. All that swelling is gone. We don't even know what the swelling was, honestly. I don't know if it was a bacterial infection or because the weather changed, something reacted, whether it is a wind attack, nothing. Because it's somewhere thousands of miles away. So I want you all to see one thing, that we are only going by symptoms. We are not actually diagnosing. Like throat pain, I am not making a diagnosis whether you got throat pain because of infection or talking too much, or even when you talk too much, your throat will become hoarse. We are not at all going by that. We are going purely by symptoms, and that is why this is very easy to see, easy to treat. Okay. Next, what is the next common pain we have? Shoulder pain. Here, neck pain, cervical spondylitis. Very, very common. Okay. So what you can do is, I didn't have the bigger tape, so I have stuck two smaller tapes. Take a row of seeds like this, chana or matar, and then, which is the cervical region? This is the cervical region. Just put it like this. Normally, these bigger seeds don't stay well, so you put a cross tape. Put a cross tape like this. Yeah, put cross tapes like this to hold. So this is where you have to put if you have any neck pain, this region at the back. But supposing you are not able to isolate and your entire neck is paining, right? Apart from this, you can also put and cover this entire region with methi strip. So if you want to do that, what you would do is, yeah, just see here. If you want to cover a larger region, just take a strip and put some methi seeds like this. And you can put it over the entire region. So this will cover all this region throughout. Completely you can put. No problem. Don't put it too tight, because the seeds can get irritating after some time. If you put it very tight, they prick you. But it should not be too loose that it falls off. So you will know, your body will tell you what is the optimum pressure for it, which it can undertake. So this is where you would put for your cervical pain. Cervical spondylitis you have, you can put it here along with the neck joint, And I told you, do some simple exercises to release the pain. Next, back pain. Where is the back? The back is here. This is the lowest part of the back. Now again, don't bother. My pain is between L4 and L5. My pain is in the sacral region. My pain is between T11, T12. You can't isolate and tell exactly. So unless you go take an X-ray and all that, you can't tell. Simple. After all, you put it over the entire back. That's all. And what you can do is, there is what is called as a 3-point strategy. That means if you have a point, put two close by. Okay, this is recommended by Professor Park Jae-woo. So this is my back. So put one here in the side and put one more strip here. So 3 strips you can put. And always when you have back pain, make sure you put on the cervical also, even though you don't have a neck pain. The reason is, as I told you, the cervical is the base from where the signals come. So it is more beneficial if you include the cervical region also. So you can safely put this. I have all these treatments I have used extensively, and it's given a lot of relief to people of all ages. Next, what you can do is, whenever you have back pain, what we do is, see, these are 2 kidney beans. So, okay, rajma beans. So along with this, you can put it at the kidney point. You can put this on both the hands. See, these are the 2 kidney points. You can put it like this. This you can do for other kidney issues, People who are taking treatment, let them continue with this. See, if somebody is taking some treatment, let us say they're going in for some allopathic treatment, or they've had a surgery, you can use all this to supplement the treatment for easy recovery, post-operative, post-surgical recovery, and to maintain. See what happens, some people, let us say, they have an issue, knee problem, they're taking some medicine or some physiotherapy, do it. Along with this, you put this knee joint also. So it will supplement. But if it is mild, you can just use this and it will be equally good. Okay. So we have covered pains. You got no? Shoulder pain, frozen shoulder, knee pain, hip pain. And whenever you have knee, also use the hip. Right? And if you have a pain in the wrist. And another thing, sometimes what happens, you have pain in a particular movement. For example, knee, it may not pain when you're walking, but then it will pain when you're bending it, let us say. So now what you do, this is my knee joint, na? Just bend this. It's like, give this movement. You'll feel, those who have pain, you'll immediately feel it. So you can do this. So wherever your body has become rigid, you can activate those points on your fingers. You cannot activate those points on your fingers. Like I said, if you have a frozen shoulder, just rotate it. Hold here tightly and rotate. Immediately, you'll find they'll have a lot of relief. Continue the treatment for some days. So these are all some of the pains we saw for the throat, then for tonsillitis, etc. Next, lungs. So what are the common problems you have with lungs? Breathing. Many people have breathing problems, asthma problems. So this is your lung region here. Here is the lung, and here is, in the middle, you have the heart. Right? So just, you can pump it. So as I said, put your thumb at the back and with full pressure pump. Most of us will feel pain here because we don't take it. Quite a few of you will feel pain whenever if you pump hard enough. That's because we don't take care of our lungs much. Breathing, we just leave it to itself. So a little bit of 10 to 15 minutes of pranayama every day will help you to regularize your breathing. These are all some good practices along with this which you can do. So just pump like this. Okay. Now, supposing you have a lot of congestion. What happens? The phlegm should come out, right? So what you can do is rub it upwards like this. Give a pressure upwards. I learned this from Archana Trivedi ma'am, and I have tried it with kids and it works like this, upwards. Okay. The phlegm, it will help the phlegm to come out. And if you have a problem with breathing, both inhaling and if you have a problem only in inhaling, some people can't inhale, they gasp. The breath, they can't take it, right? So what happens? The air should go in, no? That time you make a downward movement. My daughter has this problem. So I have told her to do this whenever downward. Literally, you're telling it to go down. If it's a general breathing problem, pump. It will give you immediate relief. 5-10 minutes, you will get relief. And then what you can do? Take methi like this. Since the surface area for the lung is large, 1 or 2 seeds will not be enough. Take like this. Stick it. Just randomly stick it and put it. Like this. Here and here on the lung region. Don't bother if you cover more area. This is the lung, your left lung, right lung, you have like this, you cover that region. Okay. This is very good. And stomach, I told you, just fold your ring finger where it meets you. Here is the stomach. Stomach and all very easy. You can just use, 1 or 2 seeds. This chana dal. Yeah, chana dal. You can just put like this. you can just put like this. Okay, for the stomach. Now, we'll see one more thing. This point, where will it correspond in your leg? Tell me. The corresponding here, in the palm, it's here. Where would this be in your leg?
Liver.
The heel. The heel. Right? This is the toes. These will be the toes. This is the foot. This will be the heel. Right? So whenever you have any issue, gastric issue or anything, you press your heels. Press your heel. Like you're sitting down, no, just press your heels. Walk on your heels. Walk on your heels and walk on your toes. It will release the gas. This is also very good when there's a lot of congestion of gas in your chest. Very often, whenever there's a pain in the chest, most often it is gastric, but it looks very similar to the pain you get when you get a heart attack. So a lot of people panic when they get pain in the chest. So first thing you can do is just walk on the heels and rub these points. You can just rub hard like this. Yes. And that will give you, see, as I do this, I'm getting burping sound because I finished my dinner. So you see, I'm walking on the heels. This is also very good. And any digestion issue, your small intestine. Any digestion issue, your small intestine, which is here at the center. It's large portion. So you can just take methi seeds like this and stick it at the center. Press it and then stick it. Yes. Both the hands. Take it. Okay. Next, issues with your liver. How do you know you have an issue with your liver? See, whenever you have an issue with your liver, what happens is you will feel hungry, but the sight of food will be nauseating. If you see food, you don't like it. You don't want to eat. Whereas if there's a problem with your stomach, you don't feel hungry only. You don't feel hungry if there's a problem with your stomach. But if there's a problem with your liver, you feel hunger, but you have what we call as nausea. So that time, your liver is affected. So this part is the liver. So again, it's a slightly bigger region. So you can just put 3-4 chana dals and put it here at the liver point. And in all this, prior to applying the seeds, just give simple pressure. Prior to applying the seeds, you can just give simple pressure. Clear? Yeah. Now I will show you some more points. I'm just seeing if I have left out anything. Yeah. I'll show you some points which are useful. Okay. One is what Dr. Devendra Vora's book he has given. He uses something similar to this. He also recommends seed and just simple pressure. One is for severe, throat pain and lot of congestion. He says apply pressure at these points. And one very nice way of applying pressure I have found is using these clips. These are clothes, normally what we use for clothes. Only thing is ensure that these clips are not metal and they're soft plastic. You get such clips. I bought this especially for this. You can see. So for throat, 1, 2, 3, and 4. These 4 points. You will find it in his book. His book is titled Health in Your Hands. Leave it for 30 seconds or 45 seconds. Maximum 1 minute. Remove it. Wait for around 5 or 10 minutes. Apply again. It works excellently. Works very well. Okay, I have found it very useful. As I said, there are so many sources. So as you start treating, you can evolve your own methods of treatment. And another one mentioned there, for sinus, even this works very well. Whenever your nose is blocked and you have a lot of headache, everything, heaviness, phlegm, congestion all over your face and head, I just put clips on all the nail ends like this. Just put clips. These clips are very soft padded. So leave it like this for about a minute maximum. Remove it and repeat again 2-3 times. By the time you do, you will just find it all coming out. So I have tried it with all my family, my friends, whoever comes and asks me. This is another very good, effective treatment. And there is one very good treatment for headache. One thing is, whenever you get a head, this is the head portion, right? This is the head portion. So hold your thumb tightly. Put pressure. And you can just put methi around this, like this, completely. Put it around. And there is one point. This is not a correspondence point, right? So here on your thumb at the back, from the center, you draw a line. And on this first joint, slightly towards your index finger. See? Can you see? This point is towards my index finger. So very simple to look at. Just draw a straight line. And on this joint, slightly towards your index finger here, you can put a black circle, black or navy blue, dark blue, indigo blue, or you can put a seed. You can put 2 methi seeds, or if you have a magnet, you can put a yellow magnet, both the hands, on this hand also. On this hand also. Even yesterday I did it. So I stay here. There's a nurse here who had a severe headache. She said, "Ma'am, I'm getting headache every day. I'm taking Imol. But after 2 hours after waking up, it comes." I said, "Come, let me just try it." I put 2 magnets for her. And she says, "I'm so happy." So you can do this. This is a Chinese meridian point, GB20. It works beautifully. And when I went to the Char Dham trip, everybody in the morning, I would put these points, all those who had issues of migraine, because all the triggers are there when you travel. The temperature is extreme hot, extreme cold. Your food is not on time. Your sleep is not on time. And everybody, it helped. Yeah. Somebody said, show the point again. Yeah. Just draw a line from the center, shift here on this joint slightly towards your index finger. I told you all these don't bother too much about the accuracy because you are going to cover that area. If you use acupuncture, you have to be very, very clear. Otherwise, this is for headache. What's that for? This is for headache. This is for headache. You can use that. That has worked. And another thing which again has worked very well. Again, this is from Dr. Vora. What's happened? Just a minute. He is stuck. Yeah. This, of course, these are some points in his book. Whenever there is fever, the index finger and middle finger, just tape it together. Actually, it's a way of applying pressure, right? So whenever a person has fever, my sister was in Bhutan and her son had high fever and she said, "What do I do?" This was one of the things. Just tape it like this and leave it for some time. And along with this, just wipe the face and the body with a cloth dipped in warm water. And then give some hot water for the patient to drink and ask them to sleep and cover them. The fever just subsides. So this is again, thanks to Dr. Vora. This is a protocol which he has given, and I have found it very simple and very effective. Okay. And so I'm just sharing some other protocols for common problems which you can use apart from seeds. And another one is whenever there is an infection, right, on the middle point, you can put black for all the fingers, here and here. So in Ayurvedic acupressure, there are many things mapped on the middle joint. I'll not go into the details because that will be a lecture in itself. And this, like this, for infections, or when you travel, when you go out, you put like this on all the fingers, you'll be, safe. Right? I was working during COVID, and we had to go to college every day. And I used to do it, and, didn't get it. I didn't get COVID at all, and nothing happened. So this is like this for all the fingers. Here is middle here and here. You can apply. This is another very good protocol. This was also given to us during COVID. And again, for fever, this, I think, again, I got this protocol from Archana ma'am only, I think. I'm not sure, in one of the lectures, because it's there in my notes. I don't know how many of you are in the habit of making notes. I write everything I find interesting, and so there's a lot of repository I have. See, from here, web, draw a line here, and from here to this tip. This again is very good for fever in children. So this is your CV meridian. For those of you who know, this is a meridian. It's one of Chinese meridian. Points are there. It works very well for fever in kids. So you can try this. So these are all some other common protocols for common things which we have used. Now, supposing you have issues like constipation. Okay. Yeah, somebody has said, Rakesh Kumar, it's very good for fever. I have tried and works very well. Okay, good. I had mentioned this in my first semester class also last time. Now, another common issue, especially with age, is constipation. Right. So one thing is, as I told you, all our activities are because of signals sent by the brain. Now, the brain should send the signal to the large intestine to throw out the waste product. And that normally happens in the squatting position. Our good old Indian toilets, which were there. Now, if you remember the figure I showed you yesterday of the large intestine. So it is like this. See? It's like this, right? Like this. You remember the figure? Otherwise, you go and see the chart. So you have 3 portions for the colon. 3 portions for the large intestine is also called as the colon. And these are the 3 portions. So these 2 points essentially need to be pressed. So when you sit in a squatting position, automatically your knees will press those points in your large intestine. So now, since we all mostly use Western commodes, that pressure is not there. So the issue of constipation is more, right? So for that, you can just activate the large intestine points here. You can look at the chart and see where the large intestine is. You activate these points. And another very good thing is squat. Just drink some warm water and squat. Squat means sit like you would sit in an Indian toilet. And in Yogasana, it's called as Malasana. It's called as Malasana. So you sit in that position. Or you can sit in that Ayyappa Swami position. You know how Ayyappa Swami sits? On his toes with the heels like this. So these are all very good for relieving constipation. Instead of taking some medicine to, forcibly throw out the stools, these things will definitely help you. So I think I have covered whatever I wanted to do. And one last thing, your hormones, are all at the mercy of one gland, and that is the pituitary gland. It's like a master controller. And you'll be so surprised. It is one kutti gland. It is the size of one chana dal. That's all. It is this small, one pea-sized. This is the size of the gland. And any disturbance, problem with this can throw everything in your body out of gear. And where is this gland located in your body? It is behind inside the brain behind the ridge of your nose. In your brain behind the ridge of the nose. So where would it be here? Somewhere here. This is nose, na? Behind that. So activating this point is very, very useful. Every day, your thumb. You know, and you can just put one chana dal here. That will activate your pituitary gland. All your hormonal problems for ladies, menstrual problems, pimples, and all those things, everything will be taken care of if you activate this. So the thumbs are very, very important. And as I said, for general health, spend 5 minutes every day. Activate, twist your fingers, rub your wrist, beat this, all this. You know, very, very, very good. You can just do it. What you can do, take a pen. So you see here, these pens you have a jimmy, there's a wooden roller. If you don't have that, just take a simple pen. You have ridges here. So these will act as, just to do this. It's as good as giving pressure from a jimmy. All over your hands. And you can buy a foot roller. It is available for less than 100 rupees online. Put a mat on the floor, keep the foot roller and just roll your feet. Yeah, you can use rings and all that, but everybody may not have access to it. You can do this. This is
I want to ask acidity point.
Gas point, please activate your stomach and intestine points. So do this. Okay. So keep doing it every day.
What about the teeth, ma'am? Teeth problems?
Teeth and all here we don't do. Correspondence is not there. You have to use other methods.
Ma'am, what to do for acidity?
I told no, activate your stomach point, small intestine and large intestine. Mainly small intestine and stomach. That is the center of your palm. And this. Heel. Where is your heel? This is my leg. This is the ankle. Right?
Yes.
So just here will be the heel point. So here, press here.
Okay.
This is the heel point.
Okay,
so,
thank you very much, ma'am.
Yeah. So if you have ankle pain, put a methi strip around the ankle joint. Heel, you put it above. And just activate this point. You will find pain. You put it, press it there, you will find the pain. If you have heel pain, definitely the correspondence will pain.
Okay. Thank you very much, ma'am.
Ma'am, what about the wounds, madam?
Huh?
Wounds. Yesterday I told
wounds, yeah. Wounds, I will tell you. This also works beautifully. This I think Professor Rizvi or one lecture it's told, I don't remember. I think it's Professor. Let us say I have a wound here. This red is a wound. This wound could be like, you know, you've fallen down and there is a wound there. It could be an abscess, some pus or something. Or it could be any burn. It could be wound because of a burn. I have used this for everything. And very simple. All that you have to do is take a black pen and circle it around the wound. You know, I have used it extensively in my lab. When my students do soldering, they all burn. And I have a lot of colleagues who have young children. So whenever they fall, I told them to do. And those kids have given a name for this as black magic. And I have given it for burns, severe burns. Like, you know, hot oil has fallen on my cousin and she had a huge blister. I just told her, and this was all for my own trial. I wanted to try out. I said, you do put this. And within 3-4 days, it doesn't break, you know, that's the beauty I have found. And the logic is very simple. Black is one color which absorbs light of all colors. It absorbs everything. That's why it is black. So what happens is when you put it around the wound, all the light gets absorbed by this black. So light has energy. So around this wound, the energy increases. Or you can say the heat increases. And what will happen? Any water, pus, anything there will just go away. And again, when I went to Chardham, the first day I tripped and fell. And I had a deep wound in my knee. I did this. Second day, it had just, coagulated and completely gone. This, you can try. I can vouch for it. Many people have used it.
Ma'am, for prostate enlargement, can we put a methi strip there?
Here, yeah.
Press there, yeah. Press there and also put a methi strip.
Yeah.
Okay. Thank you.
You put above and here, cover it, yeah.
Okay.
Because it's the entire pelvic region, na?
Okay.
So you can do it.
Yes, thank you.
So I think I'll hand it over to Ravindra, sir.
Ma'am,
Yeah.
ma'am, during menstrual cycle, can we apply that point?
Yes, I told you it works beautifully during menstrual cramps. If you have magnets, you can put yellow magnets. 3 magnets here. I've seen it work like 3 here and 3 here.
Okay, ma'am. Thank you.
Ma'am, for hypothyroidism and thyroidism, which is very common, stimulating this throat area, will do. What about seeds?
Here, you have to put 1 chana seed here, and you can put in the pituitary gland also, here and here.
Okay. Yes. Thank you.
So friends, before I propose a vote of thanks, there is a small announcement.
Menstrual
Hello.
clamp, which magnet?
Yellow.
Okay, thank you.
Can you repeat for thyroid one more time?
Here, you put 1 seed here
Okay.
and here. Here.
Yeah, sure. ma'am. Thank you.
So friends, on coming Sunday, we have a class on tips and tricks to locate TCM points related to treatise 1, 2, 3, 4. That is, TCM fundamentals, how to locate and what is the usefulness of these points. This will be very useful to, to apply your theory to practice. Whatever theory you can really apply it by attending this class. It will be conducted by Professor Sangeeta Burmanji, who is also another stalwart of our Samsthan.
Yeah, don't miss that lecture. It will be
from 11 a.m. to 12:30 a.m. on Sunday in the same Zoom ID. I'm going to send a message to everyone. And then friends, there is a Andolan. Revolution is taking place in India to spread this divine knowledge. The motto of our Sansthan, our headquarters, is to teach one, treat one, and reach one. This we have to do with zeal and enthusiasm. It is not, with commitment, we have to really bring in new people to join this and make our country medicine free. It is possible. That's why I request every one of you to please get 1 fresher for first semester. And I can assure you from my end that we will give maximum support in their endeavor to know the subject well, to get them clarity and confidence to treat. We'll do our best. Friends, you have to really, reciprocate. Then only our purpose will be much more meaningful. And on behalf of all of you, I extend my full-hearted thanks and gratitude to Dr. Uma Rao K for rendering a captivating session today also. Really, I'm sure all of you have enjoyed and you apply whatever you have learned, you apply. I can tell you that you will get fantastic result. Efficacy of seed therapy is the greatest, I can say, because you will not have any confusion whether to tone or sedate. By just stimulating the point, energy flow will be regulated. The smooth flow will happen. No need to bother about whether to sedate or tone. Yeah, just stimulation through this seed will regulate the flow of bioenergy, thereby restoring the health. We know that whenever there is a disturbance in the pathway of energy in the meridians, disease occurs. Is it not? And throughout our life, if you want to be happy, your energy flow has to be normal. Then only, disease occurs only when there is imbalance in the flow, as Dr. Uma Rao has yesterday explained. If by chance in all the meridians, see, there are only 14 meridians in TCM, all of them put together, they create an electromagnetic field which assists every cell to perform its duty. A cell cannot perform its duty when there is no supply of energy. Through acupressure, we restore the connection. It is very simple. By stimulating the acupoints related to that particular organ or location. What is the difference between a dead body and a human body? Dead body also got all the systems like skeletal system. But it will not work because there is no energy supply. That's why it is called dead. Whereas when energy flow is restored through acupressure, health is restored, and even otherwise, if you stimulate every point every day, you will not get any disease. It's preventive also. So, friends, please make use of the information, knowledge, what you have gained today and yesterday, and I'm sure you will get more confidence to treat because efficacy is already proved. It looks so simple, but it is very effective. So kindly, practice it. In the days to come, there will be some more classes on seed therapy as well as color therapy as well as fundamentals of TCM. There will be regular classes in addition to semester syllabus-based classes. We will inform that through all our groups, and those who are not yet joined, I request them to please join the course. We will take you deep into the subject. So with this, I once again extend my thanks to Dr. Uma Rao for rendering a wonderful session.
Thank you, sir, for the opportunity.
Now, be blessed by the divine Uma Rao. Really great performance. I'm really telling you, wonderful.
Thank you,
And
sir.
we are very, very proud of you because you are from Ishan. So very nice of you. And we'll catch up again on Sunday morning, 11 o'clock for yet another good session. Till then, goodbye. Thank you once again.
Thank you.
Thank you, ma'am. Thank you, ma'am.
Thank you, ma'am. Thank you, sir.
Thank you, sir. Thank you,